because the Navigator app is
That
designed to be
I
a
would do
place where
this job
people
even if I were not
are
being
connecting with
paid.
each other.
The problem
It's really a passion.
people in my family are dealing with
Partnerships and
generational health issues.
Especially
Sure.
because I'm a single mother, be a part of their journey.
Welcome to Healthier Habits, where we dive into health and wellness challenges and connect you with local resources here in Chicago. I'm Cassandra Zumba.
And I am Ya Kwachi. We're your policy, systems, and environmental coordinators with the Chicago Partnership for Health Promotion, a program under the Office of Community Engagement and Neighborhood Health Partnerships at the University of Illinois, Chicago. Hello and welcome to another episode of the Healthier Habits podcast. Today's esteemed guest is Cammi Allton. Cammi is the Resident Services Coordinator for the Southside Chicago properties of Mercy Housing. She graduated with a bachelor's degree in human development and learning from University of Illinois at Chicago and has spent the last 10 years doing humanitarian work. From animal care to childhood education to case management, her approach has been to understand others within the context of their environments, values, and experiences. She utilizes this understanding to connect others with deeply individualized support and resources. She's particularly passionate about accessible resource and community development because she believes that a well-supported environment is the baseline of healthy individuals and communities.
Welcome, Cammi. Thank you so much for being here.
Yeah, thank you guys for having me. I'm really excited to be back at my alma mater. Go Flames.
Yes. I'm glad you made your way back to UIC.
Thank you.
To start the conversation, we just want to hit, something simple so we can get to know you. Today's question is, what's your favorite movie or show that you've been on?
Great question. Netflix has released a whole bunch of updated seasons recently, and I just binged all of the new season of Black Mirror. I love Black Mirror. Very relevant.
Hey. I think my favorite was the one where the wife just kept going on with ads. And yes, I found that very profound. Yeah. And then the eulogy one where the guy thought the lady has been cheating this whole time and was like mad, and then found a letter where she was just waiting. That broke my heart.
That was brutal. That one was brutal.
Yeah. But what about you?
Yeah, I'm not caught up. I'm sorry. I have no idea what you're talking about. But in an earlier conversation we had, my entertainment tastes, it tends to be a little more light and fluffy. There's a lot of things going on in the world. I want to escape a little bit from that reality, not having that dystopian thing overwhelm me. So I'm more on the cute and comedy and stuff like that. So the last series that I saw was Love on a Spectrum. Yeah, it was. Yeah. I loved it. Their whole journey, their positivity, their awareness of authenticity, right?
Yes.
There's nothing going on in front of physical barriers that they're next. No, it's really actually getting to know the person.
Yeah.
So that was my latest episode.
Yeah, I think I have also quite enjoyed watching that show as well. But for me, a movie, I've seen it twice. And I know you were you're not as scary as you first said, but I loved Sinners. And I've seen it in theaters twice. And I just love everything about Sinners. I like the gore, the fighting. I love
everything by here. You will not be seen by me, but I totally support. I support.
Yeah. No, it was a great choices we have over here. So, Cammi, thank you again. And obviously, a bio is just a very small thing to what you do. So can you introduce yourself again and share your background?
Yeah. So yes, I'm currently resident services coordinator for Mercy Housing Lakefront. And yeah, just like the bio mentioned, I've done pretty much exclusively humanitarian work throughout my entire career. I really got into working with people after I started working with kids. I spent about 5 years working with kids. And it was during that time that I took more of an interest in the mental health field, working in that sort of area. So I transitioned out of working with children and I got a job in outreach. My previous role before this one, I was an outreach specialist, and I acted as a liaison between Mercy Housing and another organization in Chicago called the Community Counseling Centers of Chicago. So that really introduced me to this population that I work with now in a much more intricate and authentic way. And I just really loved the Mercy mission. You know, they're all about justice, respect, and mercy. That's kind of those are our main core values. And, you know, I just felt really aligned with that. And especially with this role, I felt like I could finally do something that was even more focused on engaging in the community and actually bringing things to the community.
So you mentioned Mercy Housing's core values. Can you tell us a little bit more about them and their facility and what they focus on?
Yeah. So the core values, as I said, you know, justice, mercy, and respect, we carry those values, you know, from top to bottom, from coworker to coworker, from coworker to clients and residents. Like, we are all about honoring the autonomy and independence and individuality of the people that we serve and that we work with. Mercy Housing itself is actually a national nonprofit permanent supportive housing agency. And over here we have regional splits. So we're over here in Lakefront, which incorporates Illinois, Indiana, and Wisconsin. So permanent supportive housing is pretty much exactly what it sounds like. It's not transitional. It's not assisted living. Like, we have a lot of on-site resources. We have on-site case management. We have on-site programming. We also have a role called community health workers that are on-site, which we can get into that a little bit later. But yeah, so the purpose is to really provide stable housing for people who are experiencing chronic homelessness, and to, you know, reduce that. And so it's, like we said, it's not temporary, it's not transitional. You can stay there for as long as you want. You can stay there till you know, get back on your feet and find something better for you. It's up to you. And, you know, our job as staff is to support that. And, you know, especially whatever that looks like to the individuals. We have multiple case managers on site at every building. Everyone has a caseload. And so we, you know, really prioritize meeting with these people and, you know, figuring out exactly what we can do and with the resources that we have.
Okay. I think you just mentioned you just recently joined, or it hasn't been quite long that you joined. So how did Mercy Housing come about? Like, what is the history behind Mercy?
Yes. So Mercy Housing is a national organization, actually was founded in 1981 by the Sisters of Mercy in Omaha, Nebraska. And even though it was founded by the sisters, it's not a religious organization. It's not religious affiliated. You can have, of course, whatever religion you are, but, you know, it's not as an organization. We're not particularly religious. But, so yes, Mercy was beginning over in Omaha, and over here in, you know, the Chicago Midwestern area, we had a different type of housing development called Lakefront SRO. And, you know, they were also permanent supportive housing, but they didn't have quite everything that Mercy has now. They wanted to add services. They didn't have the case management. They didn't have the programming when they were Lakefront SRO. So in 2005, Lakefront SRO and Mercy Housing actually joined together to become Mercy Housing Lakefront, which, like we mentioned, was, you know, includes Illinois, Indiana, and Wisconsin. And it was actually one of the first organizations in the country to really develop permanent supportive housing this way. So it kind of, you know, made the way for everyone else to follow suit.
Yeah. So I think you mentioned that I guess the audience that you do serve are those who are suffering from homelessness. Is there a certain criteria you have to meet, or is it just geared towards a certain, you know, in I guess in terms of the homelessness, who exactly can come to Mercy Housing for support?
Yeah, so there is a bit of a criteria. We follow the U.S. Department of Housing and Urban Development criteria for, it's called chronic homelessness. And it generally, you qualify as chronically homeless if you have been homeless for a consecutive year, or if you have had 4 episodes of homelessness over the span of 3 years that equals 12 months. That's basically, kind of what we focus on. We also serve a lot of people with disabilities. We take veterans as well. We have a couple of buildings that are focused on families, but otherwise it's primarily individual housing. And we take subsidies or non-funded individuals.
You spoke about how Mercy Housing has additional support services, right?
Yes.
So can we touch on a little bit on kind of some of the challenges you see people face entering, and then what kind of services you have there to kind of address or help guide them through particular challenges?
Absolutely. So I think some of the most common things that we see in terms of obstacles are accessibility, transportation, and financial, especially with the current economy. Things are hard, things are stressful, eggs cost $1 bajillion. And so it's hard to feel, motivated to really, I think, do a whole lot of self-care otherwise. And a lot of people have also, we serve a lot of older individuals as well, just by happenstance. But I think with that comes, they've been experiencing the system for years, and, they've kind of been told that they can't do something, or they can't have access to something, or they see how restricted access is. And so they don't either, when they come to us, they don't know about resources that exist, or they don't know how to go about finding those resources. Or, if they have like some kind of mental or physical disability that, kind of prevents them from getting those things taken care of, that's where we come in, particularly with case management. We make a regular point of meeting with everybody on our caseload on a regular basis. And, we connect them with pretty much whatever they say they need, however we can do it. So if we need to connect people to food banks, we always have lists of that. We have several other healthcare related partnerships, mental health, physical health throughout the city. So we are, regularly referring people to that, and, making sure that, of course, when we have, permission to exchange those informations, like we are following up. We're following up with the residents. We are following up with the other providers. It's a very, very, connected and collaborative network. And we're working on that even more this year. We're going through some kind of organizational changes to make things better for everyone. And we're really, really doubling down on, kind of making a team that addresses even like one person at a time. Like, that's my favorite thing about Mercy Housing. Like, we will literally have entire meetings where the meeting might not necessarily be about one person, but just this entire group of people just problem solving, trying to figure out how to best support one individual. And I love that. I love that about us.
It's great to hear that it's a team effort, especially with a lot of organizations who are reliant on like public funds, are very stretched out. And as much as you want to do to like focus on case-by-case individuals, sometimes things have to happen in group settings because there's just not enough manpower. There's not enough like mental capacity. There's a lot of factors that involve, and seeing that you're making an effort to make sure that everyone feels seen and heard is special to your type of facility, because as much as other organizations want to do the same, sometimes it's not possible.
Right.
So I think you touched on health and you touched on healthcare. What are programming that are available when it comes to like nutrition? And I think from just like reading, it seems like you have some partnership with like us beforehand. So can you touch a little bit on like obviously the programs that are available with like nutrition and health, and then how does that, look like on?
Yeah. So yes, we have quite a few partnerships. I guess we can start touching on the UIC partnership a little bit. That's a nutrition and cooking class that we have once a week for about an hour and a half. We have it at 2 of our properties right now. And that's where the residents learn, new nutrition facts. They learn, new ways to cook and just different ways to, just little changes they can make to make their meals and food habits healthier. And that has been going very, very well for us. It has been a very rewarding experience so far. The residents that are participating in the group are incredibly engaged. They are actually like retaining and recalling the new knowledge that they're learning from the program. We like, even if I, see them or run into them like outside the class, they'll want to talk about the nutrition class and what they learned and what they're doing differently. One of the big things that I guess a lot of them have changed up after one of our classes a few weeks ago was switching out a lot of like high sodium canned goods for the more affordable and less sodium like fresh or frozen foods. They were very, very surprised to learn about that.
When I used to teach in classes, I think that was one of like the small changes that were very surprising to individuals. You would think sometimes when people have this like extra sense of like, oh, of course it's going to be healthier, but it's not given. If you've never given that education or if you haven't seen that around, how are you supposed to know, right? So having those little tweaks and that information can make a big difference in the long run, especially in somebody's health.
Yes.
And I think when people are going through homelessness, one thing on their mind is not eating right or having, or maybe they just don't have the access to the fresh produce or to that. So it's great that a facility is able to provide that because that might also, increase their livelihood as well because, you're worried about, having a place to stay, having a place to put your head up, but then also sustaining your body because that's also important as well too.
Yeah, and I think that's one thing that we emphasize in our classes are different, I don't want to say tiers, but different like levels you can go through.
Yeah.
First and foremost, I want to make sure you have something on your plate, right? That's the most important thing. Now we have a little bit of a leeway to choose from one to another. You want to make sure that healthy choice is an easy choice. So just knowing that information. But just having nutrients in you is the most important part.
Absolutely.
And then you mentioned you have a plethora of partnerships. So I want to give you the opportunity to go in depth more on those partnerships.
Thank you. Yes. So I think one of our biggest partnerships right now is we're working with the Food Smart program with County Care. So they come to us periodically and they go to all 12 of our buildings at different times. And they do actual nutrition presentations and they do, kind of rotating topics. And they usually give the residents a nice bag of fresh produce at the end. And these are like well-stocked bags too. It's not just an apple and a banana. You get like half of the grocery store aisle in there. So it's really nice that not only do they get the nutrition information out of that, they actually get to take something with them. And as I said before, we also have community health workers on site. And their role, they're very similar to the case managers in that they do a lot of one-on-one and they check in with the residents periodically, on a regular basis, that is. And they are specially focused on approaches to reduce diabetes, heart disease, and hypertension. And the health workers kind of get to decide how they want to approach that at times. So they might have different groups or individual coaching, whatever works for them and their building and their residents. But that seems to be really effective. We get pretty good responses from that. At one of our other locations in Wisconsin, we actually have a partnership with Advocate Health. So they come out there and they periodically do presentations as well. Not so much on the partnership end, but in terms of like initiatives and things we do. Mercy Housing Lakefront, we have an annual program called the Feel Better Challenge, which happens every summer for about 8 weeks. And it's where we explicitly focus on using community and community activities to promote health and wellness. So we hold different groups every week that are all focused on very health-oriented things, whether it's physical health, mental health, other food stuff. One of the things they really love is like chair yoga. That's a big hit. And so, yeah, we do that about 8 weeks out of the year. We also have, I think, county care comes for that sometimes too. And, they give another, more grab bags and all that good stuff. We also make sure that when we are providing like refreshments and things at our functions, that they are pretty healthy or at least, accommodating, because we do have, people with diabetes or maybe people with celiac. So it's just, we try to keep all those things in mind to be both, accessible and accommodating. And with our Feel Better Challenge, we are also looking to extend that even more than just the summer. We're still kind of in the works, figuring things out, but it's such an effective program and the residents love it so much. And it really is like one of the biggest community things that we do. And we measure, from beginning to end. They do assessments at the beginning of the program, at the end of the program, to kind of compare, what did they know before, what were they doing before, and how did the summer experience change what they're going to do going forward.
Yeah, I was just going to ask, how do you track the challenge or how do people participate?
So yes, we actually have a little bit of an incentive. They get a certain amount of points if they go to groups. It also is a little bit competition because they have individual points per resident, and then they have points for the buildings. So each of the buildings kind of gets ranked, and everybody gets prizes, varying depending upon what they ranked in. There's also weekly raffle prizes for the groups. So yeah. And then they're really good stuff too, but we try to focus on giving them practical things with the prizes. One of our major prizes last year, I think, was an air fryer. The resident that got it is still very much in love with it and talks about it all the time.
Now, that's good to hear because I know several times that I work off goals or challenges. Yeah. Because it just mentally, it just makes me work towards something. Yeah. Even though I know it's for my own good, I know that. But I need just that extra push.
That competition.
Mm-hmm.
Yes.
If I had an air fryer that I'm going to win, you will see the competitive side come out. I think one thing I love that you mentioned was you have the nutrition side at Mercy Housing. You have the physical activity side. You have the food access side. Those are kind of, I wouldn't, maybe a term for the holistic, seeing the individual as a whole to all the different parts that might affect their health. So what are some long-term goals regarding community programs, mainly focused on nutrition education or food insecurity, that Mercy Housing plans on doing or they're in the works of doing?
Yeah, I think, at this point, we're really open to pretty much any new proposed initiative. Like I said before, we're looking to expand our Feel Better program. I guess a partner I completely almost forgot to mention them. We are also partnered with Near North. So, in terms of that program, I think one of our overarching goals is really to just kind of expand our reach with partnership and, figure out which other organizations in the community we can serve as much as, they could help us out.
Yeah. Do you anticipate any type of barriers in sustaining these initiatives, or are there any challenges that you may be facing now that could, maybe hinder that process, or just any barriers that?
Yeah, I think our general biggest barrier when it comes to actual programming is when it's not hosted on site. When it's hosted off site, that can, change things up for the residents sometimes because some of them might not have income or might not have enough income, so they're not able to get around as much. Or, they may have a physical disability that limits them from doing certain things or going to certain places. Or, times when we have to do but when we do big group trips, that can cost a lot sometimes. So, those are kind of the biggest obstacles that we see and that we try to, focus on mitigating. But even with that, we are also working extra hard this year to make our things and make our programs and events even more accommodating and even more accessible. For example, with our Feel Better program, we usually do a trip out to Starved Rock State Park.
That's myself.
Yeah, we love that trip. They love that trip. It's a great time, but not all of our residents are physically able to get on the bus to go there. So this year we are really working on figuring out what kind of cool local things that we can do to help residents, still be involved and still get the opportunity to participate and get their points, but they, get to do it in a way that's most feasible for them.
If there's anyone out in the audience that would like to support your organization, in which way can they do that or can they reach out?
Yeah, there's plenty of ways they can do that. We are on social media. You can find us on LinkedIn, Facebook, or Instagram. You can just look up Mercy Housing. You can also get on our email list or general email list by going to mercyhousing.org/news/ that second backslash is very important. I learned that this morning. And we also have I think, lakefront specific newsletter, which I don't have the exact HTML right now, but
I can put it in the description.
Perfect. Yes. But yes, those are the general ways to reach out to us, and we're very responsive and we love to hear from people. So if anyone wants to reach out, we welcome it.
Do you have any, last minute messages for anyone listening? Any call to action?
I guess all I can say is keep fighting the good fight.
Well, thank you so much for your time. We really do appreciate you coming here to talk to us. And this was a lovely conversation.
Thank you. It was a pleasure being here.
Eat, move, save.
Thanks for listening to Healthier Habits. We hope this conversation inspired you to make the healthy choice the easy choice.
If you enjoyed this episode, please support the podcast by liking, sharing, and subscribing. Don't forget to turn on that notification bell so you never miss an episode.
Head over to healthierhabits.podbean.com to catch up on past episodes and find all the links and resources mentioned in today's show, or click around here on YouTube for more videos.
Thanks again for tuning in to Healthier Habits. Until next time, take care of yourself and stay healthy.